Hi, my name is Brandy.
And my name is Sandy.
We're nurses on the Medical Telemetry unit at Phelps Health. We are the winners of the Patient Experience Award for Compassion.
So one morning I came into work and I assumed care of a young soldier that was transferred to us from a local facility. He had experienced some seizures, and he was quite nervous when my initial assessment of him. So I just did my best to try to calm him and assure him that he was in good hands. He did give me his mother's phone number, and his mother did call. So I spoke to her and gave her my assessment and what the plan was to care for her son. And she did say how nervous she was, that she was so far away and she's never really been this far away from him. So I just did my best with relaying what I knew of, her son's condition to her, and what the plan was, to provide care to him. And I just assured her that I would keep in touch if there was any changes in his condition, and that I would call her and keep her updated throughout the day.
So the following day, I assumed care of this patient, and with his permission, I spoke with his mother and informed her of his condition and our plan of care. With him, he was nervous, he was scared. His future had just taken a left turn. This gentleman didn't want to do anything but serve his country, and he was afraid that he wasn't going to get to do that anymore. So my part wasn't only physical, it was mental as well. I was trying to help take care of him and ease his worries, because as of that moment, there wasn't anything he could do but take care of himself. So when his mother arrived, she came rushing in like any other concerned mother would, and I gave her the same information on what we were doing and the plan of care. It had been a very high stress situation for the both of them. And the thing about nursing is that not only do we care for the patient, both physically, we care for them mentally, and also another big part of them is their family. And while this was a grown man serving our country, he was still a little boy to his mom. So it was satisfying and comforting for me to be able to give them some sort of peace and understanding of what their situation was.
So in our day-to-day action, we always have an opportunity to serve not only our patient but our families, and being mindful of putting yourself in their shoes.
Being in the healthcare field, there are many ways that we can show compassion and make a positive change in our patients' and customers' lives. So look for an opportunity in your everyday. See who's around you and see if you can help and make a difference in their lives.